In the bustling year of 1848, the American landscape was being reshaped by the railroads. Among the determined men laying these iron veins was Phineas Gage, a young foreman. September 13, 1848. Cavendish, Vermont. Phineas Gage, a 25-year-old railroad foreman, prepares a blast to clear rock. Phineas was known for his steady hand, keen mind, and amiable disposition. His crew admired him, his employers considered him their most capable leader. He was tamping powder without the protective layer of sand. A spark ignited the explosive, and the heavy iron rod shot upwards. It entered Phineas's left cheekbone, tore through his skull, and exited his head. The rod landed 80 feet away, a horrifying sight. Shockingly, Gage walks, talks, and sits upright in an ox cart. He's conscious and coherent, even telling his co-workers he'll be back to work in a day or two. He was taken to the hospital where Doctors Harlow and Williams remove bone fragments and drain infected tissue from Gage's skull. He battled infection and fever, but against all odds, Phineas recovered physically. However, the accident had left a profound and unsettling mark on him. The iron rod had destroyed a significant portion of his left frontal lobe. The old Phineas was gone, his personality had changed drastically. He became coarse, impulsive, disrespectful, and profane. His employers found him fitful, irreverent, and he lost his job. As his physician famously observed, Gage was no longer Gage. In his later life, he travels, briefly tours as a curiosity, works in a livery stable, then drives a stagecoach in Chile from 1852 to 1859, showing regained competence. In 1859 he moves to San Francisco. In February 1860, he begins suffering epileptic seizures and dies on May 21, 1860, at age 36. Phineas's case demonstrated the direct link between brain regions and personality. His story became a cornerstone in the field of neuroscience, changing our understanding of the brain. Gage's skull and tamping iron are preserved at Harvard's Warren Museum. His case became the cornerstone of brain localization, showing the frontal lobe governs personality, decision-making, and social behavior. A man who changed neuroscience. Gage's accident offered the first real-world proof that different brain regions control different abilities, especially the frontal lobe's role in personality, decision-making, and social behavior. Neuroscience and Psychology Foundation. His story kick-started modern study into how brain damage affects behavior and laid groundwork for neuropsychology and brain surgery development. Later analysis shows some accounts exaggerated his personality change, yet the core lesson about brain behavior links remains solid. That's it for today, folks. We will come back with more exciting facts and cases about psychology.